Receding gums can be attractive. It can actually lead to tooth loss, but a lot of people avoid conventional grafting surgery because they believe it's too invasive. Here to tell you some more about a new procedure, Dr. Alan Huang, DMD with SDS Dental in Las Vegas. Thank you so much for joining us. I do appreciate it. When I hear receding gums, I imagine, or I have a vision of like a beach kind of receding from high tide. It's almost eating away. But what causes gums to recede?
Okay, so actually, gum recession is a pretty serious oral health issues. There's many issues that when we have gum recession, it can lead to bone loss. It can lead to sensitivity of the roots.
Sure.
And then more seriously, patient who smile really high, it could be an aesthetic compromise. We typically see recession from adolescence to adulthood.
What causes the gums to recede?
There's many reasons. One might be overzealous in terms of brushing.
Oh, really?
Yes.
Interesting.
One might be you're born with very thin tissue, that's biological. And then obviously from gum disease process, poor oral health care.
How quickly can you get into a situation where you have gums recede? Or you talk about poor oral health care, but does that mean someone who completely neglects, or can you be a twice-a-day brusher and still have?
Yeah, long-term neglect.
Yeah.
This is typically pretty much a long-term neglect. It doesn't happen overnight.
Sure.
So.
Oh yeah, this has been a while. Maybe you skipped the dentist appointment one too many times.
Oh yeah, you can't do that.
Okay, so we talk about ways to correct.
Yes.
If you're having gums receding, how worried should you be, and how quickly can you correct the problem?
Well, you should be really worried because, like I said, long-term neglect typically might lead to more recession, more bone loss, and eventual maybe loss of the tooth.
Yeah, you don't want to have to do that.
No,
so, when it comes to grafting surgeries, obviously we hear that, we get a little worried. But this is a new kind of new form of doing it. It's pinhole rejuvenation.
Yes.
What does that mean?
So pinhole rejuvenation, what does that mean?
Yeah.
Okay, so there's a new procedure that's been invented by Dr. Chow that basically through, is this the animation that we're showing? Okay.
Yeah, so those are the receded gums right there.
Yes. So this is a receded gum here. They're going to be showing, so through Chow's pinhole technique, we use a little incision up and above the tooth.
Okay.
I call this actually a facelift, but on the gum.
Okay.
Okay, so whereas there's no cutting involved, there's no donor site, you don't have to take tissues from your palate anymore. Healing-wise, it's pretty minimal, and minimal bleeding. So patient gets instant results from this.
Instant result, not invasive. You don't have to get tissue and remove it and transfer it. You prefer this option to the traditional grafting?
So there's obviously there's pros and cons behind that, but for the most part, if you have expanded amount of tissue recession, you can get this done in one session.
This is what you need to talk to your dentist about, and go get your checkup if you haven't been in a while. Dr. Huang, thank you so much for joining us. We'll be right back.
Okay.